work that we do here in the Nuffield Leeds Hospital is a really wide range of all sorts of spine surgery, from really simple spine surgery to really complex spine surgery.
We have critical care facilities, so the patients can go to a special ward where they are very carefully observed, where they have specialist nursing and very close nursing to be sure that if there are any problems, then they can be picked up on immediately and acted upon.
As a surgeon, I realise that I'm only one small part of a cog of a patient's journey. We have fantastic nurses here. My patients are consistently telling me not only the nurses, the food is good here, the environment's good here, and that's been a lot of hard work to make it such an excellent place. And that's been reflected by the CQC inspection, which showed this hospital is outstanding.
Some spine surgeons are neurosurgeons by training, some are orthopaedic surgeons. Here we work very well together. All of our patients are discussed in a multidisciplinary meeting before deciding about the final operation.
The Nuffield is one of the flagship hospitals, and because of that we have the state-of-the-art equipment. The Nuffield have invested in navigation systems. It's a computerized directed screw placement. We do know that in spinal surgery some of the screws are misplaced, which means a reoperation and can damage the nerves. Here we have 99.9% accuracy of screw placement. Very few private hospitals have this technology.
The investment made in the CT and MRI scanners within the last year has made a difference in terms of the quality of imaging and also the patient experience that we can provide.
In terms of the procedures we do here, we do it on a regular basis. This is not once every couple of weeks. We do it day in, nearly every day we do surgery. We have visiting surgeons coming over to learn new techniques. We can do operations as a day case. These are using very small tubes called tubular microdecompressions. Rather than the traditional open operations, it's keyhole surgery. And again, the Nuffield have invested in the equipment to enable us to do that safely and consistently.
I'll sit in with some of the consultants in their clinics, so I see patients presenting with their symptoms. I will then see some of them again when they come for a pre-assessment, so I just go through their medical history, take blood, send them for ECG, that kind of thing, make sure they're fit enough for surgery. Then I'll see them when they come to the ward, just say hi, and it's quite nice for them. They see a familiar face. They've already seen me twice before they are admitted onto the ward. So I'm a point of contact for them, so when they go home I give them my number. They can call me if they've got any worries about their wounds or pain that they're in.
We see the patients on the ward either on the day of their surgery, after the operation, or the following morning. Some of the patients are discharged home the day of surgery if they've had a routine microdiscectomy. The majority stay overnight. So we come and see them, and it's about building a relationship with the patient to give them the confidence to move their bodies after complex spinal surgery.
The ability to relieve people's pain and improve their mobility is very, very rewarding. And for the older patients that we see, they may have been very scared to put themselves forward for an operation. However, getting them safely through an operation like that and giving them the ability to be active, be part of the community again, and to give them the confidence to even go out and do simple things like do their own shopping, meet people again, is really, really rewarding.
Well, it's very nice to have all this equipment, and to be honest, essential for my practice. What is really important is the outcome of the patient, and the Nuffield, myself and the patients want an excellent outcome. Before theatre, when we're seeing the patient, their outcome scores are put on the British Spinal Registry. We look at those scores and make sure my practice is up to date and the outcomes are consistently good.